So, good afternoon. I'm Heather Goins with the Institute of Child Nutrition, and I would like to welcome you to the December 2023 CACFP 101 webinar, Supporting Breastfeeding-Friendly Environments. And as a reminder, during today's webinar, all attendees will be muted. There will be time for questions at the end of the presentation. And if you have a question, please type it into the question box on your screen. We will try to get to as many questions as possible, but due to our time constraints, every question may not get answered during the webinar. After the webinar ends, a link to complete a short survey will appear. Please complete that evaluation survey. 24 hours after the webinar, individuals who have registered will receive a follow-up email. The email will contain a recording link of this webinar, which is available on iLearn, ICN's online learning platform, and a link to the evaluation survey in case you missed the pop-up link. ICN will send out webinar certificates of attendance within 24 hours, and due to the nature of this webinar, the slide deck will not be shared with our attendees today. This webinar will only be available in video format. So by the end of this webinar, attendees will identify best practices and tips for supporting breastfeeding in your child nutrition program, including staff training. The views and opinions expressed in this webinar are solely those of the presenters and do not necessarily reflect the official policy or position of the Institute of Child Nutrition. So I am going to introduce our guest speakers. Today we have Dana Huntley and Jessica Bridgman. Dana's work focuses on preparing childcare industry professionals as they navigate and implement practices that support human milk feeding families throughout their early care and education journey. Dana's work also includes infant and young children feeding in emergencies and expanding lactation continuity of care. She conducts trainings and provides one-on-one technical assistance related to the Carolina Global Breastfeeding Institute mission. She is an active member of the United States Breastfeeding Committee and a co-founder of Queen City Cocoa Beans, a Charlotte, North Carolina-based organization with a mission to improve African American health through increased human milk feeding support. Jessica at Carolina Global Breastfeeding Institute. Jessica works with Enrich Carolinas to improve maternity care and breastfeeding rates. Her primary role is to help create resources and training that will expand supports available to CHEST breastfeeding families in ECE settings. She believes the early childhood workforce plays an essential role in the lactation care continuum. She has over 5 years experience with CACFP and served as an external reviewer for USDA resources, including Feeding Infants in the CACFP and Breastfed Babies Welcome Here. Jessica's work also includes infant and young child feeding in emergencies, and lactation continuity of care. She is a registered and licensed dietitian nutritionist with over 17 years of experience in the field of nutrition and dietetics and public health research. So I'm very, very excited to welcome them to our webinar today, and I hope that you guys will enjoy listening to the things that they have to offer. So without further ado, welcome to Dana, and after Dana speaks, Jessica will join.
All right, hello, and thank you for having us. Jessica and I are excited to have this opportunity. One thing we like to start out saying is that when we think about our environments and the many factors that influence families, we know the use of inclusive language is key. You might hear a variety of terms used today, including CHEST breastfeeding, lactation, human milk feeding, and the use of families, parents, guardians, birthing parent, and mother. We'd like you to think for a moment, why is supporting breastfeeding in ECE important? What does this look like in practice? We know the impact of consistent messaging being shared by all who interact with families to provide care before, during, and after birth is an approach that can lead to improved outcomes for the lactating family. Creating a welcoming environment is one way to provide consistent messaging to families. Childcare provider support can influence a family's decision to continue CHEST breastfeeding. At first glimpse, you may consider The support your program offers families, small or even unnoticed, but for human milk feeding families, they will view any supports that are provided to them in the childcare setting as invaluable to aiding them in their journey. Today, we'll share guidance and tips for creating a supportive environment at your childcare program. But first, we're gonna start it off with a poll. And as that comes up, the question is, do you have families come to your program to breastfeed on site? Oh, I think we have a different poll showing up. I think we had some responses for the policy one. Thank you for doing that one.
Sorry, Dana, we're going to release the other poll. We released the second poll prematurely, so we're going to redo the poll for the first one so that it's accurate and reflects the right content. We apologize for that.
Okay, so this poll, do you have families come to your program to breastfeed on site? All right, so it looks like 52%, over half of you do have families that feed on site. 35% do not, and some of you are not sure. Thank you for sharing with us. Now let's see where support in early care and education fits into the bigger public health picture. So the National Association of County and City Health Officials, or NACCHO, has a breastfeeding public health impact pyramid, which offers a bird's eye view of the role we all play in public health. At the top is more individual effort for providers such as clinicians, and then towards the bottom is more community impact. We're focusing on the changing the context section with the star next to it. This is where breastfeeding-friendly childcare efforts and supportive environments fit into public health impact. And the goal is to change the context by so that we make health the default decision, the easy choice. Supporting breastfeeding and ECE is well recognized and promoted through various national organizations and resources. Here are a few we wanted to share today. The USDA's Breastfed Babies Welcome Here resource contains communication tools and a poster that CACFP operators can use to let families know that chest breastfeeding is welcome at their site. The image in the middle is the cover of NACCHO's Continuity of Care Blueprint, The goal of this blueprint is to ensure that chest breastfeeding support services are continuous, accessible, and coordinated, and that community spaces are consistently supportive of chest breastfeeding families. Then Caring for Our Children provides detailed guidance on preparing, feeding, and storing human milk, and outlines accommodations that will ensure continuous support for lactating parents and program staff. And you can check out Appendix JJ for detailed guidance on breastfeeding, chest feeding at your program. And it also has a page focused on inclusive language. We wanted to bring to your attention some recent changes at the national level, which address and strengthen support for families providing human milk. The American Academy of Pediatrics recommends support for continued breastfeeding until 2 years or beyond. This 2022 policy shift is an expansion of the previous recommendation of 1 year. Another national level change, which was signed into law in December 2022, so it's been about a year, is the Providing Urgent Maternal Protections for Nursing Mothers Act, or the PUMP Act. This expanded the legal right to receive pumping breaks and access to a private space to nearly 9 million more workers. And you'll see in the chat a PDF explaining the PUMP Act is included there, and it's also going to be on a resource PDF that you'll receive. So we've covered background on why it's important to provide supportive environment and a glance at national efforts. Let's look at opportunities to provide a supportive environment at your program. Programs are encouraged to offer a quiet, private area that's comfortable and sanitary for families to use to chest breastfeed their children on site. If your program participates in CACFP, human milk is reimbursable when a parent feeds on site. This includes the program staff and when the provider feeds expressed human milk. And just to note, if the parent leaves the premises, the meal is not reimbursable. This table has ideas for creating a lactation space that serves families and staff. As an employer, by law, the bare minimum requirements for a space are it not being a bathroom, shielded from view, free from intrusion, available when needed, and having a chair and a flat surface. But these are nice to provide for families, even if it's not law. Licensed childcare rule in North Carolina does require these for families. Honorable mention and bragworthy build on basic space requirements and show how you can continue to scale up comfort if desired. And the Office on Women's Health site is included in that resource list and has a lot of space and break solutions and videos, which not only serve as a resource if the program has human milk feeding employees, but a resource to share if parents or guardians need solutions for their place of employment. Breastfeeding Supported Here posters are an easy way to communicate your program supports chest breastfeeding. Displaying posters contributes to normalizing lactation. These can be hung in the dedicated lactation space we just discussed, but we also really encourage hanging these posters in all areas of the program to promote support to families that might not realize and normalize human milk feeding in general. So we encourage you to step back and take a tour of your program. What does your environment communicate to visitors and staff? And then another way to change the environment is through books and toys. Do classrooms have books that show breastfeeding? Is there curriculum around how animal and human babies feed? If you do not have funds to purchase these, check out your local library. And then we've also shared a great resource for ideas. I think that will be in a link to that will be in the chat for curriculum ideas and books and toys. So now I'm going to pass it over to Jessica to share other ways to get started on your supportive environment or build on current efforts?
Hi. So thank you, Dana. And as we get started, we're going to do another poll. So now we're going to go back to the first poll that flashed briefly. And we want to know, does your program have a breastfeeding policy? So yes, no, or I don't know. Okay, and here are the results. So we have 60% of you say that your program does have a breastfeeding policy, 19% do not, and 21% say that you don't know if your program has one. Thank you so much for participating in the poll. That's really helpful to know. So as you train your staff to sustain your supportive environment. Think about your program policies. And if you do not have a policy that outlines accommodations and support that will be provided to families and program staff, you can create one and also request continuous feedback from staff and families. And you might not be sure where to start. So you can review the resources that Dana shared earlier. So Caring for Our Children is a really great resource. Also, the United States Breastfeeding Committee has this really great interactive policy map. So anything breastfeeding related policy that your state has, you can access that and learn about that through this link, and we'll put that into the chat. And also on the right is a CDC resource, and it's scoring breastfeeding supports and ECE licensing across the country. Another really great resource for you to take a look at as you develop your breastfeeding policy for your program. And if you already have a policy, be sure to revisit it annually and update it. Another aspect of creating a supportive environment training programs is training program staff. So don't forget to train your floaters too. And if you're seeking online training opportunities, here are some free options that are available to you. The Carolina Global Breastfeeding Institute Learning Management System, it's called Breastfeeding University, and it offers professional development and breastfeeding support tailored for ECE. You can complete 4 modules and you will earn 2 hours of continuing education credit. And we'll drop a link to that into the chat. Also, through the Arizona Department of Health Empower program, you can access a 45-minute module on how to create a breastfeeding-friendly environment. And we'll also share that resource with you. And if you're seeking in-person training options, we encourage you to invite a local lactation consultant to speak or present at your staff trainings. You can maintain a listing of local lactation consultants as a resource that can be shared with families enrolled in your program. And we're also going to share a link so that you can find a local lactation consultant in your area. USDA has several helpful resources. The CACFP Trainers Tools, Feeding Infants takes all the content from the USDA Feeding Infants and the CACFP Guide, and it repackages it as training resources. You'll find quick videos like labeling bottles, and you can download presentations. And there's even one on creating a breastfeeding-friendly environment with trainer notes. And as you train staff, remember to train staff on the recent change to the CACFP human milk storage guidelines. So human milk can be stored in the facility's refrigerator for up to 4 days from the date it was expressed. This is new for CACFP. The policy memos previously stated that it was 3 days. And if your state or local authorities have stricter regulations, be sure to follow those. And we will also place the most current policy memo with those new storage guidelines into the chat for your reference. CDC also has really great ECE resources for creating a supportive environment, including handling and storage human milk and transition to solids. Have that resource for you too. And on the CGBI website, you'll find 2 toolkits which address breastfeeding support in ECE settings, and we have a link to that page. The Child Care Program Toolkit includes tailored materials to support staff and families. So you can see on the right there, it consists of self-assessment materials. There are also job aids, educational materials for all families, and education materials specific to human milk feeding families. And the other CGBI toolkit, the Continuity of Care Toolkit resources, help to ensure consistent messaging between families, healthcare providers, and childcare providers about lactation and feeding human milk. You can share these resources with families touring and enrolling at your program. And on the right is a checklist for families specifically that are touring your program. Knowing these questions recommended to families can help programs be prepared for what the types of questions families will be asking. And we do have a link for that resource as well. Okay, it's time for another poll. And for this one, we want to know, does your program's emergency preparedness and response plan include the handling and storage of human milk? Yes, no, or I don't know. Take a moment and think about your EPR plan. We can see the results here. All right, so we've got 23% say yes, it includes handling and storage of human milk, 39% no, and then we've got a close 38% I don't know. Okay, thank you. And so the next one, we have one more poll here. And for this one, we want to know, does your program's emergency preparedness plan include the handling and storage of infant formula? Yes, no, or I don't know. Give you just a minute to a couple seconds more to respond here. Okay, so let's see these results. We've got 37% yes, 34% no, and 30% I don't know. All right, well, thank you for your participation in those polls. So we would encourage you to continue to support human milk feeding even during emergencies. And a part of that is being prepared, especially with your emergency preparedness and response plan. We wanted to share some new resources that we have that were just released this year, and they provide guidance and considerations both for feeding commercial milk formula and human milk in emergencies. And you'll also learn tips in these resources to adapt your ready to go kits to ensure that they support infant feeding. And that does conclude our presentation for today. And if you have any questions about how to create a supportive environment at your program, you're welcome to reach out to us and share your questions. You can see both my email and Dana's email. If you'd like to have any questions, want to reach out, connect with us. And I think we'll transition to some Q&A now.
Thanks, Jessica and Dana, for coming on today and talking about creating a more breastfeeding friendly environment. I haven't had the opportunity to look at your emergency booklets for infant feeding in the event of an emergency, but I never really thought about it until, and I've been out of the classroom for a really long time, hadn't really thought about that. And a lot of people, I know Dana had said that they assume another person's taking responsibility for it. But would you care for either one of you or both of you to share a little bit more about this resource since it's newly released? I think it's great. I'm going to take a look at it later, but if you could just share more information about that with our audience, that would be amazing.
Yeah, definitely. We can do that. So the foundation, I guess you could say, for these resources was the Carolina 10 Steps to Breastfeeding Friendly Childcare. So we took those 10 steps and adapted them so that they were supportive. They could still be followed during emergencies, and we added considerations for how to ensure that your program would be following those 10 steps to breastfeeding friendly during emergencies. So the toolkit, one of the resources is specifically, it goes through and outlines details on those considerations and provides some recommendations and guidance on how to do that. And then the second resource is specifically devoted to those ready to go kits and what resources they can contain to ensure that your program will be able to support infant feeding during emergencies and do that safely.
Are these kits that are, it's just printable resources. It's not necessarily like we have a food safety kit that we use here at the Institute that we distribute, and it's a thermal tote that has thermometers and recording logs. So when you're saying toolkit, it's just printable resources that anyone can print from where they are. It's not something that you would ship to them or anything like that, correct?
Yes, that's correct. These resources can enable a program to build their own kit, but it is not, we're not shipping those materials to programs.
Yeah, we're piloting with our child care health consultants in North Carolina. So they would have demo kits, and we're kind of working through that project right now, but we are not shipping to each program in North Carolina or outside of North Carolina. And Heather, I'm seeing in the chat, the last few links are for the CDC toolkit. So just to clarify that what we're talking about is a CGBI, a different toolkit.
Okay, I'm going to go and look for that resource again. I apologize. While I'm looking for that, could you guys elaborate more? I know there was a question earlier about the term chest feeding, and I responded that it was a more inclusive term that promoted health equity. Could you maybe talk a little more about that, as some of our audience members may be unfamiliar with the term? USDA has not spoken on changing that term within any of the guidance. So could you perhaps elaborate a little more on what that really means for our members who may not may not have heard that term before.
Do you want me to take that one, Dana, or do you want to take that one?
You can go ahead and start.
Yeah, so we you heard that term used in our presentation today, and as Heather shared, it is an effort to ensure health equity and ensure all families feel included. So we use those terms. I do want to say it's always important to ensure that your families that you're working with, you have open communication to them, so you learn what terms that they prefer that you use. So wanted to add that as well. And you can see Caring for Our Children has also released a resource that specifically talks about inclusive language. So that's a really great resource. I would definitely encourage you all to take a look at that. And you can see how how they're encouraging the use of that language and the content. Head Start also has a really great page on inclusive language, and they also use the term chest breastfeeding.
I just want to acknowledge, I saw the comment that you've been in CACFP for 2 decades. It is definitely newer terms. It's not something that you've missed over the past few decades. It's a newer shift towards being mindful of different families. And then another comment I wanted to make specifically for us trying to shift to human milk feeding versus breastfeeding is that some families, if they're expressing milk and feeding in a bottle, they don't feel like they're breastfeeding because they're not feeding at breast chest. So just trying to be more inclusive so that any way you're providing the human milk, we're talking about support for those families.
Thanks for that clarification, Dana. Is there any other questions that our audience may have? We're going to stay open for a little bit longer to answer any questions that you may have. I've updated the link in the chat box. Also, we are going to upload a resource tab for you guys that has all of the chat features. I'm sorry, all of the links that were in the chat for you all to take a look at so that you can download it. Also, the Word document will be available as the Word document will be available as an attachment on our video when we upload it to our iLearn series. One of the questions that we have was there a link to the Breastfeeding Supported Here posters? I would love to post them in our center. And correct me if I'm wrong, ladies, but I think that link is in the resource document as well. And I will try to go through here to see if I can find the link again. Any other questions that you guys have, audience members have, aside from the posters? We have people coming in saying, thanks for that. So we're going to work on that for you. Any other questions for the ladies here today that you guys may have? Can I give you guys just a few more minutes? All right. It looks like all hearts and minds are clear today. Thanks again for joining us. If you guys have any questions, as always, y'all can reach out to us here at the Institute at theicn.org, or you can email us at the help desk. Also, thanks again for your gift of time, ladies, and also for sharing your expertise. And also to our audience today, thank you also for your gift of time. And I hope that wherever you are, that you are enjoying this holiday season, doing what you love the most with the people that you love the most. So have an awesome day. And thanks again, guys, for joining us.